Hi, my name is Cameron LaBarge, and today I'll be running you through how to do a hip and knee eval. So we're going to start with the hip. So the first thing that you're going to want to palpate is greater the greater trochanter, and that's going to be located, should be right in this area. You'll feel it, the bony prominence, it'll stick out right around the side. Right on the lateral side. And then if you run a little bit more forward, more towards the femur, you're going to find the lesser trochanter. And that'll be more towards the medial side of the leg. And then obviously then you have the big bone, the femur, running right down the middle. Now there's 3 areas here that I won't palpate, but I can show you, and it's out of respect for my patient. The pubis is obviously right in there, right in the middle, and is along with your pubic symphysis and the pubic tubercle. They're all in that area, right in the middle. Then the next palpation that you'll do is the ischium, which is located more towards the bottom of the whole hip and pubic area. It's right under the pubis bone. It's right on the bottom. So that's where that is. The next thing would be the ischial tuberosity. And that would be on the opposite of the ischium. So the ischium is on this side, on the right leg, and would be on the right side, and then the ischial tuberosity is on the left side. It's right on the bottom. So that's where you'll find that. So the next on the list would be the ilium. So the ilium is located ilium would be located, it is the big hip bone. So it sits right here, and it's the iliac crest sits right around here. It sits right on top. It's like the top of the hip. But the ilium is the meat. It's the big bone right there. So it just kind of sits there. And then we move to the ASIS, the AISS, and the PSIS. So your ASIS and AIIS, they're going to be located pretty much around, like I said, the ilium sits here, and then the iliac crest is around here. So what you're going to find is that on the bottom of that iliac, like on the top of the lip, right on the bottom of that, it's like a little hanger. That's where your ASIS sits. It's right in there, and then just a little bit further down, that's going to be where your AIIS is. So that's where that's located. And then your PSIS will sit more medially. So that'll sit, like I said, your ASIS is around here, and then your AIIS is here. So then your PSIS will sit more medially, so in that area. Okay, then we move on to soft tissue ligaments. So your iliofemoral ligament is going to, it connects, so your femur's here, it runs to where your knee is. The iliofemoral ligament is the ligament that connects the hip joint and the femur. So it'll sit, it's a large ligament, but it's going to sit in here. It'll connect those 2 areas. So then the pubofemoral ligament Well, all three, the pubofemoral, the iliofemoral, those two are kind of in the same spot. So, again, like your iliofemoral will be more, I guess, superior. It'll be more up. It'll be up here, and then your pubofemoral will be more towards the pubis, so it'll be more medial. And then finally, the ischiofemoral ligament. That you're gonna. So it's more on it's on this side. That's how I can identify it. But the ischiofemoral is that's the whole, like it's like this. It's like it is over here. It's a giant ligament, but it's the entire thing. So it'll sit. It's the entire ligament, and it connects the femur to the hip joint. It's all the same. So then we move on to soft tissue, muscles, and tendons. So the first one would be the elopsis. And the elopsis is the So the elopsis will be just around your hip, so right in here. It'll kind of curve down, but that's where your it's near more towards your hip. That's where the elopsis sits. And then it will go down to your sartorius, which bless you, starts at the hip, and it'll curve down. It'll curve down this way. And then you'll go to your pectineus, which your pectineus is located, it starts near the pubis, near the pubic area, and kind of cuts across. So the sartorius comes around this way, and your pectineus comes around this way. So then we move on to the adductor magnus, longus, and brevis. So those are all kind of in the same area, but so the adductor longus it sits more, I guess, interior, you could say. So that sits around like here. That'll sit here, and then your adductor magnus will sit off to the side. But they're basically almost in the same area, but again, one's more interior, and then the adductor brevis it'll sit down here. It runs more. It goes down. So then the gluteus maximus is another one of those muscles that out of respect for my patient, I'm not going to do that. But that's going to be your butt muscle. So that's your butt. Then the gluteus medius. Then we have the gluteus medius, which will sit up here. So that's right here. In that area is where your gluteus medius sits. So your butt muscle is the gluteus maximus, and that would be your gluteus medius. And then finally, you have your tensor fasciolate, like I said, there would be your gluteus medius. So more towards the front, but more towards the anterior part. So right around here would be where your tensor fasciolate would sit. Okay. So now what we're going to do is we're going to do some active range of motion, passive range of motion, and manual muscle testing. So first, what we're going to do is I'm going to have you come up towards the front. I'm going to have you sit up. So what we're going to do first we're going to do flexion. What I'm going to have you do is put here. You can put your leg up here if you want. So what we're going to do is I'm going to put force here.
Can't see what you're doing. Not at all.
And what you're going to do is you're going to resist bringing your knee up. Okay? So go ahead. 1, 2, 3, 4, 5. Okay? So, and then we'll grade it on a scale of 0 to 5. 0 being you can't complete the motion at all, and 5 being you're able to complete the motion. I'd grade that a 5. And then obviously in any other case we testify laterally. And then then now it's extension. So what I'm going to have you do is I'm going to have you lay on your stomach.
Oh, my stomach?
Yes. So lay on your stomach. So what we're going to do, I'm going to put a hand here and a hand here. So what I'm going to have you do is I'm going to have you resist force upwards. So I'm going to push down as you pull up, okay?
Yeah.
Get ready, go ahead. 1, 2, 3, 4, 5. And again, grading 0 out of 5, I'd give that a 5, and then we testify laterally. So then what we do, we're going to do a abduction and then a deduction. So for a abduction, I'm going to have you lay on you can lay on your right side. So sideline, lay on your right side. And I'm going to have you bend this leg back and bring this leg straight out.
You're blocking everything.
Okay. So what we're going to do, I'm going to put my hand here, and I'm going to push down as you try to push up against me. Okay? Ready? Go ahead. 1, 2, 3, 4, 5. Again, that would be graded a 5 on a 0 out of 5 scale. And then we'll do a deduction, which I'll have you straighten both legs. I'll bring this leg up with me. No, keep that one down. And now what we're going to do is you can bring this up a bit. I'm going to push down as you pull up. Okay, go ahead. 1, 2, 4, 5. Okay, and that would be graded a 5 again at a 0 out of 5 scale. So then what we're going to do now, it's internal and external rotation. So what I'm going to have you do again is sit up and bring your legs out. Now bring them at a 90-degree angle. So now what we're going to do is we're going to take it by the knee here, and you're going to try to push in like that as I resist. Okay, go ahead. 1, 2, 3, 4, 5. So that I would give a 5 on a 0 to 5. And then we're going to do external rotation. So it's going to be the opposite. So you put your hand here, and you're going to try to go out as I push in. Go ahead. 1, 2, 3, 4, 5. Okay? So that's manual muscle testing and that. So now what we're going to do is the circulation. So if you can sit back a bit, just so your legs are extended. So first to do pedal pulse, I'm going to find this right here. And that's normal. So then what we're going to do is we're going to find the distal pulse, which should be, it's right under, it's right here, right under here. And that's normal. Okay, so now what we'll do is the special test section. So first we have the Craig's test. And the Craig's test, so what we're going to do is I'm going to have you lay on your stomach and flex one at 90 degrees, so bring it up. And then what we're going to do is we're just going to grab by the ankle or the tibia and medially and laterally rotate the tibia. Just in and out like that. Okay, so that's the Craig's test. Next on the list is the hip scour test. So I'm going to have you lay on your back again. Okay, so we'll bring this, flex your knee a bit, and we'll bring it up. And we'll hold here, and we'll just bring it back and apply longitudinal pressure, and then we'll externally rotate it. Okay, that's the hip scour. Next on the list, the Patrick's favor test. So for the Patrick's favor test, what you're going to do, actually hold on, we'll skip that one and come back to it, but first we'll actually do the fader test. No, we can do the favor one. Okay, so can you go back more towards that, back that way a bit more. Keep going, just a bit. So what we're going to do for this one, we're going to bring it up, flex a bit, flex in, oh, it's going to go. Actually, here, okay, so bring it up and then flex the knee, and then push it down that way. And what you're going to do is you're going to slowly push the knee down towards the table. Slowly push it down. Okay? So that's the favor test. Then we have the fader test. So I'm going to bring the knee up, flex again, and we're going to start like this. Hand on the knee, and here, and we're just going to go out. So have it up here, and then bring it down like that. And twist it, in a sense. You just twist it. Okay, so that's the fader test. Now the posterior labral tear test, or the Fitzgerald. So we'll start here again. So start more lateral. And this time, you're just bringing it in like that. Okay. And next is the log roll test. So I'm going to have you just extend your legs. One hand here, and we're just going to roll like that. Just roll. That's the log roll test. Super simple. Then we have the piriformis test. So we'll have it here, flex. So then what we're going to do here is just simply go out like that, bring it back, go out like that, bring it back. That's all a piriformis test is. Super simple. Next on the list is the Thomas test. So this one, the Thomas test is actually that the patient does that himself. So what you're gonna do, I'm gonna have you bring your knee, take it with your hand, and go like that. So pull it up towards your chest and hold it. Okay, so, and then all we're watching for is how it hangs off the table. Actually, I did that wrong. Bring that back down. Can you come come to the edge of the table as far as you can get off? I'll put that there. So what we're gonna do, I'm gonna have you push back, lay back down, and bring this up towards your chest. And watch. What you're watching for is the hang. So what you want, like this is good. This is good, but a positive would be if this comes up and it kind of hangs like that. So he's in a good spot. And then finally we have the Trendelberg sign. So for this one, it's another one where you're not really assisting. So I'm gonna have you stand up. So what we're gonna do for this, you can face that way, and I'm gonna have you bring your left leg and bring your knee up to a 90-degree angle. So pull it back a bit. So what you're doing, you're just gonna go like this. So just hold it back like that. That's my bad. All right. So go ahead. So that is the Trendelberg test. What you're looking for is the pelvic drop. So if the uninvolved side really droops, that's what you're looking for. Okay, so that is the end of the hip eval.